I want to tell you something that took me more than 20 years of practicing medicine to say out loud. The way we treat high blood pressure in this country is fundamentally broken. Not because the medications do not work in the narrow sense they are designed to work. They do lower the number on your monitor. But lowering a number on a monitor is not the same thing as fixing the problem that created the number in the first place. And that distinction between managing a reading and actually repairing what is causing it is the difference between a patient who takes pills for the rest of their life and a patient who gets their life back. Nearly half of all adults in this country have high blood pressure. That is approximately 122 million people. Of those, about 75% are on medication to control it. And yet, every single year, more than 675,000 Americans die from complications directly caused by high blood pressure, despite faithfully taking their medication every single day. Stop and think about that for a moment. Hundreds of thousands of people dying every year from a condition they are actively being treated for, taking their pills, showing up to their appointments, following the instructions, and still dying. That is not a patient failure. That is a framework failure. The framework we have been using to understand and treat high blood pressure is incomplete. And because it is incomplete, the treatment it produces can only ever be partial. My name is Dr. William Madison. I have been in clinical medicine for more than 20 years. And today I'm going to explain to you what high blood pressure actually is at a biological level, why the medications most people are taking address only the surface of the problem, and what a complete four-step approach to actually reversing the underlying damage looks like. Not managing it, reversing it. I need to say something important before we go any further. I am not telling you to stop your blood pressure medication. Do not do that. Stopping suddenly can be genuinely dangerous. What I'm offering today is a framework for understanding what your medication is and is not doing, so that you can work with your doctor towards something more than just a controlled number on a monitor. These 4 steps are meant to be used alongside your medication, while you and your physician track your progress and make decisions together about what comes next. With that said, let us talk about what high blood pressure actually is, because most people have been given an explanation that is only partially correct. The explanation most patients receive goes something like this. Your blood pressure is high because there is too much fluid volume in your circulatory system. Reduce your sodium intake to hold less water. Take a diuretic to remove excess fluid. The volume goes down, the pressure goes down, problem solved. That explanation is not wrong exactly, but it is incomplete in a way that matters enormously. It describes one small piece of a much larger picture, and by focusing almost exclusively on fluid volume, it misses the deeper structural reality of what is actually happening inside your blood vessels. Here is the more complete picture. Your arteries are not simply pipes that carry blood. They are living, active, extraordinarily complex structures that are constantly responding to what is happening around them. They expand and contract with each heartbeat. They produce chemical signals that regulate blood flow. They maintain a delicate balance that keeps blood pressure in a healthy range. When all of these functions are working properly, blood pressure takes care of itself without medication. High blood pressure is not primarily a problem of too much fluid in the pipes. It is a problem of the pipes themselves. The arteries have been damaged. They have become stiff, rigid, and less able to perform the flexible, dynamic functions they are supposed to perform. And no blood pressure medication in current use repairs that damage. The medications change the reading on the monitor, but the underlying structural damage continues progressing underneath those improved numbers. This is why people on blood pressure medication still have strokes and heart attacks. The symptom is being managed. The cause is not being addressed. There are 4 specific mechanisms that create this arterial damage and drive high blood pressure. Understanding all 4 is what makes a real structural approach to reversing hypertension possible. Let me walk you through each one in plain language. The first mechanism is damage to a microscopic protective layer inside your arteries that almost nobody has ever heard of, and that nothing in a standard blood pressure treatment plan is designed to repair. Your arteries are lined on the inside with a single layer of cells called the endothelium. This lining is incredibly thin, about as thin as a single sheet of tissue paper stretched across the interior of every blood vessel in your body. Despite its thinness, it is one of the most metabolically active tissues in your body. It produces chemical signals that keep blood flowing smoothly, prevent inappropriate clotting, and regulate inflammation in the vessel wall. On top of this endothelial lining, there is an even thinner protective coating called the glycocalyx. Think of it like the non-stick coating on a quality cooking pan. It is invisible to the naked eye, constructed from sugar molecules and proteins, only a few millionths of a meter thick. But it performs functions that are absolutely essential to arterial health. The glycocalyx creates a smooth, frictionless surface that allows blood to flow without resistance. It acts as a shield, preventing inflammatory molecules from reaching and attaching to the vessel wall underneath. And it acts as a sensor, detecting changes in blood flow and signaling the cells below it to produce a molecule called nitric oxide, which keeps the vessels relaxed and open. When the glycocalyx is healthy and intact, your arteries function beautifully. Blood flows easily, pressure stays in a normal range, the system regulates itself. But when the glycocalyx is damaged, everything downstream begins to fail. The main things that damage the glycocalyx are elevated blood sugar, chronic inflammation, smoking, and oxidative stress, which is the damage caused by unstable molecules called free radicals. When these factors strip away the glycocalyx, the protective coating dissolves. The vessel wall underneath becomes exposed and vulnerable. Inflammatory molecules from the bloodstream attach to the endothelium. White blood cells begin sticking to the vessel wall. LDL cholesterol particles penetrate into the vessel tissue. Plaque starts to form. The cells below stop producing adequate nitric oxide. The vessels lose their ability to relax and widen. Blood pressure rises. And here is the critical point that most conversations about blood pressure treatment never include. Not one blood pressure medication currently in widespread use repairs the glycocalyx. ACE inhibitors do not repair it. Beta blockers do not repair it. Calcium channel blockers do not repair it. Diuretics do not repair it. They change the number on your monitor, but the damaged coating that set off this entire cascade remains damaged. The underlying vulnerability continues. The second mechanism is arterial stiffness, and it is the one that most physicians do not discuss with their patients because conventional medicine has very little to offer for it. As arteries age and become chronically damaged by inflammation and high blood pressure, the middle layer of the artery wall, a layer composed of smooth muscle cells and elastic fibers called the tunica media, undergoes destructive changes. First, calcium deposits begin forming inside this middle layer. Calcium belongs in your bones. But when arteries are chronically inflamed, calcium migrates out of the bloodstream and into the artery wall, where it crystallizes and hardens. Second, the elastic fibers that give arteries their spring and flexibility break down and are gradually replaced by collagen, which is stiff and inflexible. Third, some of the smooth muscle cells in the artery wall undergo a disturbing transformation. They stop behaving like muscle cells and start behaving like bone-forming cells, actively depositing more calcium and accelerating the hardening of the vessel wall. The end result is arteries that have become progressively more rigid, less able to expand and absorb the pressure of each heartbeat, and more likely to maintain permanently elevated pressure. Research has established that arterial stiffness predicts heart attacks, strokes, and overall mortality more reliably than blood pressure numbers alone. The stiffness is the real danger. The blood pressure reading is the indicator of it. You can actually get a rough sense of your arterial stiffness by looking at your own blood pressure numbers. Blood pressure is measured as two numbers. The top number is systolic pressure, which is the pressure when your heart beats. The bottom number is diastolic pressure, which is the pressure when your heart rests between beats. The difference between those two numbers is called pulse pressure. Normal pulse pressure falls between 40 and 50. If your blood pressure is 162/72, your pulse pressure is 90. A pulse pressure above 65 indicates that your arteries are stiff and have lost their shock-absorbing capacity. If your numbers look like that, the conversation you need to have with your doctor is about arterial stiffness, not just the top number. No blood pressure medication reverses arterial calcification. Calcium channel blockers help smooth muscle cells relax, which is useful in the short term. But they do not remove calcium that has already been deposited into the structural wall of the artery. The calcification stays. The stiffness stays. And the most important question about this is one that most people have never been asked. Can arterial calcification actually be reversed? The answer is yes, but the tools that do it are not in the standard prescription repertoire. The third mechanism is nitric oxide deficiency. And this one connects directly to the glycocalyx damage we talked about in the first mechanism, because the glycocalyx is what triggers nitric oxide production in the first place. Nitric oxide is a gas molecule produced by the cells lining your arteries. When nitric oxide is released into the smooth muscle layer of the artery wall, it tells those muscle cells to relax. The vessel widens. Blood flows more easily. Resistance drops. Blood pressure decreases. Healthy arteries produce nitric oxide continuously, and that continuous production is one of the main reasons a healthy cardiovascular system maintains normal blood pressure without needing intervention. When the glycocalyx is stripped away and the endothelial cells underneath are damaged, nitric oxide production drops dramatically. The vessels cannot relax properly. They stay constricted. Blood pressure rises and stays elevated. The enzyme that produces nitric oxide is called eNOS. It requires a specific helper molecule called BH4 to function properly. When BH4 levels are adequate, eNOS produces nitric oxide efficiently. When BH4 becomes depleted by oxidative stress and inflammation, the enzyme malfunctions and starts producing harmful free radicals instead. More damage, more constriction, higher pressure. The good news is that nitric oxide production can be restored through specific, practical interventions. And two of them are so simple that they require no special equipment and no prescription. The fourth mechanism is the insulin-kidney connection. And this one explains something that puzzles many people with high blood pressure. Why does cutting down on salt not seem to work as well as it is supposed to? Your kidneys regulate blood pressure by controlling how much sodium stays in your body. When sodium levels are too high, healthy kidneys excrete the excess in the urine and pressure comes down. This is why reducing sodium is part of the standard blood pressure advice. But that system only works properly when your kidneys can respond appropriately to sodium intake, and insulin prevents them from doing so. When insulin levels are chronically elevated, a condition called insulin resistance, the kidneys receive a continuous signal to hold on to sodium rather than release it. No matter how little salt you eat, your kidneys are locked in retention mode by the elevated insulin. The sodium stays, the pressure stays elevated. And reducing dietary salt makes only a modest difference, because the problem is not primarily how much salt is coming in, it is that the kidneys have been told not to let any of it go. Insulin resistance also activates the sympathetic nervous system, which causes the kidneys to release a hormone called renin, which triggers a chain reaction leading to the release of aldosterone, which further instructs the kidneys to hold on to sodium. And insulin makes your blood vessels more sensitive to angiotensin II, a powerful substance that causes them to constrict. The result is a system pushed toward high pressure from multiple directions simultaneously, all driven by elevated insulin. Here is the part that most people and many physicians do not know. You can have significant insulin resistance without having diabetes. Your fasting blood glucose can be completely normal. Your HbA1c can be normal. But your actual insulin level, which most doctors never measure, can be substantially elevated and silently driving your blood pressure higher every single day. If your doctor has never measured your fasting insulin level, ask specifically for that test at your next appointment. It is a standard blood test that provides information no glucose or HbA1c measurement can give you. Now let me walk you through the 4-step protocol that addresses all 4 of these mechanisms. This is not a replacement for your medication. It is a repair program for the structural damage that your medication is not touching. The first step is restoring the glycocalyx. You cannot repair the glycocalyx without first stopping the primary things that are destroying it. The 2 biggest destroyers are elevated blood sugar and oxidative stress. Every time your blood sugar spikes significantly after a meal, it damages the glycocalyx through a chemical process called glycation. Sugar molecules attach to proteins in the glycocalyx coating and degrade it. So the first priority is keeping post-meal blood sugar from spiking. This does not mean eliminating all carbohydrates. It means choosing carbohydrates that release glucose slowly rather than all at once. Whole vegetables, legumes, some fruits, whole grains in modest amounts, and reducing the foods that cause sharp spikes: white bread, white rice, pasta, baked goods, sugary drinks, and anything with added sugar. The second part of glycocalyx restoration is providing the building blocks the body needs to rebuild it. The glycocalyx is constructed primarily from long chains of sulfated sugar molecules called glycosaminoglycans. The best dietary source for these specific compounds is a substance called fucoidan, which comes from brown seaweed. Research has shown that fucoidan supplements can help restore glycocalyx thickness and improve endothelial function. Studies demonstrating benefit have used doses of 600 to 1,000 milligrams daily. The third part is reducing oxidative stress, the free radical damage that strips away the glycocalyx like acid on a surface. The most effective dietary antioxidants for vascular health are polyphenols, found in deeply colored vegetables and fruits, berries of all kinds, dark leafy greens, beets, dark chocolate above 85% cacao, green tea. These foods neutralize the free radicals that would otherwise continue degrading your protective arterial coating. A patient I worked with was a 71-year-old man who had been on 2 blood pressure medications for 13 years. His pressure was considered controlled at 130/82, but laboratory tests showed markers of significant endothelial dysfunction, meaning his artery lining was clearly not functioning properly, despite the numbers looking acceptable. He eliminated refined carbohydrates, began fucoidan supplementation at 800 milligrams daily, and dramatically increased polyphenol-rich foods, adding a cup of mixed berries and 2 cups of dark leafy greens every day. After 12 weeks, his endothelial function test showed improvement from 5% to 13% dilation. His blood pressure dropped to 116/74. We worked with his physician to reduce one medication. After 6 months, he was off both medications entirely, with blood pressure stable at 120/76. Not because the drugs were managing it, because his artery lining was functioning again. The second step is decalcification. Most people, and many doctors, assume that once calcium has deposited in the artery wall, it is there permanently. That assumption is incorrect. Calcium can be redirected out of artery walls and back into bone, where it belongs. But this requires understanding a specific protein that most people have never heard of. The protein is called matrix GLA protein, or MGP. Think of it as a traffic controller for calcium in your body. When MGP is activated, it flags calcium deposits in artery walls for removal and directs calcium into bone tissue where it is needed and beneficial. When MGP is inactive, calcium deposits freely in artery walls without being redirected. MGP is activated by vitamin K2, specifically a form called MK7. Research from the Rotterdam study established that adults with higher dietary intake of vitamin K2 had significantly lower rates of coronary calcification and lower risk of heart disease mortality. Separate research published in the journal Atherosclerosis found that higher menaquinone intake was associated with reduced arterial calcification. Studies demonstrating reversal of calcification have used doses of 180 to 360 micrograms of MK7 daily. Vitamin K2 alone is not enough. For the calcium that is being redirected out of artery walls to enter bone tissue effectively, vitamin D is also required. Vitamin D increases calcium absorption in the digestive system and helps incorporate calcium into bone structure. K2 and vitamin D work together as partners. K2 redirects calcium. Vitamin D ensures it goes where it needs to go. Both are required for the system to function. The third component for arterial decalcification is magnesium. Magnesium is your body's natural calcium channel blocker. When magnesium levels are adequate, it prevents calcium from entering smooth muscle cells and artery walls inappropriately. It also inhibits calcium from crystallizing and forming deposits in the vessel structure. When magnesium is deficient, calcium moves into places it should not be, vessels constrict, and blood pressure rises. Magnesium deficiency is extremely common because magnesium is found primarily in dark leafy greens, nuts, seeds, and whole grains, which most people do not eat in adequate quantities. Several common medications also actively deplete magnesium, including diuretics and the stomach acid medications we have discussed in previous conversations. The most effectively absorbed forms for supplementation are magnesium glycinate and magnesium threonate. The dose for cardiovascular benefit is 400 to 600 milligrams daily. Another patient comes to mind, a 74-year-old woman who had been on 4 blood pressure medications for 18 years. Her pressure was barely controlled at 136/86. A CT scan showed severe calcification throughout her aorta, the main artery leaving the heart. She began the decalcification protocol: vitamin K2 at 360 micrograms daily, vitamin D at 6,000 international units daily, magnesium glycinate at 600 milligrams daily. After 6 months, a follow-up CT scan showed her calcification score had decreased by 9%. Her blood pressure dropped to 122/78, and her physician reduced her from 4 medications to 3. After 1 year, the calcium score had decreased by 16%. After 18 months, she was on a single medication with excellent pressure control. The calcium was physically leaving her artery walls because the biological mechanism for redirecting it had been activated. The third step is restoring nitric oxide production. There are 3 specific approaches, and the most surprising one requires no equipment and no supplement, and is available to you right now. The first approach is protecting and rebuilding BH4, the helper molecule that allows the eNOS enzyme to produce nitric oxide instead of harmful free radicals. BH4 is regenerated in the body with adequate folate, vitamin C, and vitamin E. Folate comes from dark leafy greens, vitamin C from citrus fruits, berries, and bell peppers, vitamin E from nuts and seeds. These are not exotic supplements. They are foods that many people do not eat in sufficient quantities, but could begin adding to regular meals immediately. Research published in the Journal of Cardiovascular Pharmacology demonstrated that adequate vitamin C intake measurably reduces arterial stiffness in humans. The second approach is stimulating eNOS through physical blood flow. The enzyme is activated by a physical force called shear stress, which is the friction created when blood flows across the endothelial surface. When blood flow increases, the friction increases, and eNOS produces more nitric oxide. Exercise creates this effect broadly, but there is a specific type of exercise that has been shown in multiple clinical trials to lower blood pressure more effectively than most people realize, and it requires neither a gym membership nor significant physical fitness. Isometric exercise. This means contracting a muscle without moving a joint. The specific protocol studied involves squeezing a hand grip device at approximately 30% of your maximum grip strength for 2 minutes, resting for 1 minute, and repeating 4 times. Done 4 times per week. This protocol has been demonstrated in multiple studies to lower systolic blood pressure by 8 to 12 points after 8 weeks of consistent practice. 8 to 12 points from squeezing a hand grip device for about 12 minutes 4 days a week. That is a larger reduction than many blood pressure medications produce. The third approach is the one that will surprise you most. Breathe through your nose. Your nasal passages are lined with cells that produce nitric oxide. Every breath you take through your nose delivers a small pulse of nitric oxide directly into your lungs and bloodstream. Mouth breathing bypasses this entirely. Research has shown that nasal breathing increases blood nitric oxide levels by up to 400% compared to mouth breathing. If you habitually breathe through your mouth, especially during sleep, switching to nasal breathing is one of the most impactful, low-cost changes you can make for your blood pressure and your cardiovascular health. The fourth step is the insulin reset. This step unlocks your kidneys and restores their ability to regulate sodium the way they are designed to. The core goal is bringing chronically elevated insulin levels back down to a range where the kidneys can respond normally to sodium intake. The most effective and well-researched method for lowering insulin is time-restricted eating. This means consuming all your meals within a defined window of time each day and allowing the remaining hours to be a fasting period during which no calories are consumed. For people with high blood pressure, a 16-hour fasting window with an 8-hour eating window has shown the strongest results. A practical example would be eating all meals between noon and 8 in the evening, and consuming nothing but water, plain tea, or black coffee from 8 in the evening until noon the following day. Research examining time-restricted eating specifically in adults with high blood pressure found reductions in systolic pressure of 9 to 11 points within 8 weeks, without any change in what the participants ate, only when they ate. The mechanism is purely insulin-related. When you fast for an extended period, insulin levels drop significantly. With insulin no longer signaling the kidneys to retain sodium, they begin excreting it appropriately. Fluid balance normalizes. Blood pressure comes down. The second component of the insulin reset is resistance training. When your muscles contract against resistance, they develop more insulin receptors. More receptors mean that insulin works more efficiently at lower levels. Your cells respond to insulin better, which means your body needs to produce less of it to manage blood sugar. Studies show that resistance training 2 to 3 times weekly reduces fasting insulin levels by 20 to 30% within 12 weeks. This is not complicated or extreme exercise. Bodyweight exercises, resistance bands, or light weights used consistently 2 or 3 times a week achieve this effect. Now let me bring these 4 steps together, because I want you to see the complete picture of what reversing high blood pressure actually looks like when it is approached at the structural level. Glycocalyx restoration stops the cascade of damage that begins at the inner surface of every artery, allows the endothelium to function again as an active metabolic organ, and restores the signaling environment that makes healthy blood pressure regulation possible. Arterial decalcification physically removes the calcium deposits that have made artery walls rigid, restores elasticity to vessels that have become bone-like in their stiffness, and reduces the fundamental structural cause of elevated systolic pressure. Nitric oxide restoration gives the vascular smooth muscle the chemical signal it needs to relax, so that arteries can dilate appropriately and accommodate blood flow without generating excessive pressure. The insulin reset unlocks the kidneys from a state of chronic sodium retention, restores their ability to regulate fluid balance normally, and removes one of the most powerful and most overlooked drivers of persistently elevated blood pressure. None of these 4 steps involve simply lowering a number on a monitor. All 4 of them address something real and structural inside your cardiovascular system. And all 4 of them can produce measurable changes in actual arterial biology, not just in the reading of cuff records on your arm. I want to give you something specific and actionable to do today. Not all 4 steps at once. Choose one. If your diet contains significant amounts of refined carbohydrates and sugar, start with glycocalyx restoration by cutting those foods down and adding berries and dark leafy greens immediately. If you have been told your blood sugar or insulin levels are elevated, or if you have been told you are pre-diabetic, or if you carry significant weight around the midsection, start with the insulin reset. Begin time-restricted eating this week, and aim to add 2 sessions of resistance exercise per week. If you rarely exercise and have not been physically active, start with nitric oxide restoration. Buy an inexpensive hand grip device and begin the isometric protocol 4 days this week. Commit to nasal breathing during the day and especially at night. If your blood pressure numbers show a wide gap between the top and bottom number, suggesting arterial stiffness, discuss vitamin K2, vitamin D, and magnesium with your doctor, and ask whether beginning a decalcification protocol makes sense for your specific situation. And regardless of which step you start with, begin monitoring your blood pressure at home every day, morning and evening, writing down both numbers. 2 weeks of home readings gives you and your doctor a far more accurate picture of your true average pressure than occasional office readings taken under the stress of a medical appointment. Track your readings over weeks and months as you implement these steps. Bring that written log to your appointments. When your numbers show consistent, sustained improvement, have the conversation with your physician about whether gradual, supervised reduction in your medication dose is appropriate. Do not make that decision alone. But do not accept the belief that medication is all there is, and that you will be on it for the rest of your life without any possibility of changing that. Medications manage the reading. These 4 steps repair the structure that generates the reading. Both matter. But only one of them addresses what is actually causing the problem. Your blood vessels are living tissue. They responded to damage. They can respond to repair. The biology supports it. The research supports it. And the patients I have worked with who have committed to understanding and addressing these 4 mechanisms rather than only managing the number have in many cases achieved outcomes that no medication alone could have produced. High blood pressure is not simply your fate. It is not an inevitable sentence that requires a lifelong pharmaceutical response. It is a biological condition with biological causes. And biological causes, when understood correctly, can be addressed at the level where they actually exist. I'm Dr. William Madison. Your arteries have been working for you every day of your life. It is time to give them what they actually need to heal. Take care of yourself, take care of the people around you, and I will see you in the next video.